The nation's top infectious disease expert, Dr. Anthony Fauci, is urging people to stay safe during the Labor Day holiday to avoid another spike in COVID-19 cases. That while Iowa is seeing an uptick in positive test results. Omar Jimenez reports.
In Iowa, a dangerous coronavirus surge. But even with an average positivity rate above 10% for the past 2 weeks and warnings from the White House Coronavirus Task Force, it's still not enough for the governor to issue a mask mandate to help reduce the spread.
I still believe it's up to the governors in the various states to make those decisions. Sometimes they don't have the entire picture of the things that we're doing.
Health experts here say college towns are seeing a rise in new cases as students return to campus.
Fortunately, I think a smaller percentage of those people will probably require hospital-level medical care, but it's still dangerous from a public health perspective.
This as the CDC told public health officials to get ready to begin distributing potential coronavirus vaccines as soon as late October, sending guidance advising what states and people should get treatment first, prioritizing healthcare and essential workers. The CDC's recommendations issued the same day President Trump made this statement at the Republican National Convention.
We are delivering life-saving therapies and will produce a vaccine before the end of the year, or maybe even sooner.
This timeline causing concern because of its proximity to the election.
The concern is that we're going to be rolling out vaccines to healthcare workers very, very early on in phase 3, well before we have the data to support it.
But CDC Director Dr. Robert Redfield says it's about being prepared.
We're preparing earnestly for what I anticipate will be reality, is that there'll be one or more vaccines available for us in November, December.
And the risk of an increased spread of the disease on the mind of Dr. Anthony Fauci as Labor Day weekend threatens another surge in cases.
So I really want to use this opportunity almost to have a plea to the people in this country to realize that we really still need to get our arms around this and to suppress these types of surges that we've seen. We can do it.